The Pfizer booster shot is here. Moderna's is expected to be available next, but there could be some changes apparently made to that.
And should you wait to get your flu shot if you haven't gotten your COVID vaccine yet? Dr. Ilan Shapiro with AltaMed Health Services joining us now to talk about the latest health headlines, rather. Dr. Shapiro, thank you so much. Now, there are reports that the FDA is leaning towards authorizing a Moderna booster at a half dose. What is the reasoning behind that if they do, and is it still going to be effective?
Well, it's a great question. The idea of this is they do research and they try to figure out what's the optimal amount of antibodies that we need. And they try to figure out what's the dose that our body will actually need to get to that point. With Pfizer at this point, we know that it's a full dose. There's no changes for the booster shot. But for Moderna, they're considering actually half of the dose because that will be enough to get us there and be protected.
And so I have a question about this because so many scientists have said they keep monitoring with the boosters what's been happening in Israel. And that's because a lot of their hospitalizations recently were people who were fully vaccinated, and they're trying to figure out the booster that would be appropriate for that. So my question for you is, the boosters that are being created, are they still from the original COVID variants, or, are we expecting any updates from that to try to deal with the variants that are coming around?
At this moment, the vaccines that we have right now, they're safe and effective the way they are. The virus has not mutated to the point that our vaccines stopped working. Pfizer, Moderna, and Johnson & Johnson are still effective for the COVID, the Delta variant, and the other ones are kind of cooking on the side. For the other side, the data from Israel is like 1 or 2 months, on the future compared to the U.S. Then the thing that they are seeing is lower rates of hospitalization. And yes, because the majority of the people that they have already there are vaccinated. That's why, the difference on who's actually getting there to the hospital and who's not getting there.
And Dr. Shapiro, it's time to get the flu shot, but do people need to wait if they just got the COVID vaccine? I mean, what's the recommended timing between those shots?
Right now, we are worried because last year, practically influenza went to sleep, went on vacations. And right now, we know that COVID-19 can actually mix with influenza. That's why we actually are offering, and the CDC and the FDA guidance is that, please, if you need to, get them both at the same time. We have not found any type of complications, any side effects, or any problems with that. That's why, if you're already there and you're getting your influenza shot, get your COVID shot, or the other way around.
Okay, Dr. Shapiro, thank you so much for your time on this Friday. Really appreciate it.
A pleasure as always.
Thank you.